What's the cause of arthritis? So remember Newton's third law of motion, that to every action there is an equal and an opposite reaction. In other words, there is always a cause. Many are sick through ignorance. And so what I'd like to do is I'd like to show you what some of the causes are and how you can get a turnaround in arthritis, whether it be osteo, rheumatoid arthritis, and also gout. And that's the good news. There can be a turnaround, and we've seen many conquer these things. Arthritis thrives in a very acid environment. So an acid environment in the body is one of the #1 causes of arthritis. Now, you can go back to look. Old injuries is often where arthritis can manifest itself, and there can be different factors there. There can be an inherited factor. There can be a factor of injury to that area, which makes it a little bit more susceptible. There can be an acid environment. Often a breaking of these laws, as Ellen White says, that disease is an effort of nature to free the system from conditions that arise because of a violation of the laws of health. And many people don't realise that. So I'd like to go through how a breaking of these laws could be a big contributing factor in arthritis we're seeing today. And I'd like to show you how restoring adherence to these laws can bring about a conquering of arthritis.
Today, Barbara O'Neill, an Australian health teacher internationally known for her focus on the body's natural healing potential, dives into the important topic of gout. Gout is one of the most painful forms of arthritis, and Barbara O'Neill sheds light on this condition, emphasizing its severity and the need for effective management. Gout is characterized by sudden, severe attacks of pain, redness, and tenderness in the joints, often affecting the big toe but capable of impacting any joint, including the ankles, knees, elbows, wrists, and fingers. The root cause of gout lies in high levels of uric acid in the blood, which leads to the formation of sharp, needle-like urate crystals in and around the joints. This buildup results in intense inflammation and excruciating pain. In this lecture, Barbara O'Neill will provide valuable insights into the causes, symptoms, and natural remedies for managing gout. Let's dive into the secrets of managing gout effectively with Barbara O'Neill's expert guidance. Secret 1. Consume herbs when it comes to treating gout. Barbara O'Neill supports the use of herbal and natural remedies, emphasizing their safety and efficacy in contrast to traditional anti-inflammatory medications, which can have detrimental effects on the cardiovascular and gastrointestinal systems. Turmeric is among the strongest herbs she suggests.
Ginger. Ginger is one of the best anti-inflammatory herbs that we have. Probably on equal to it, especially internally, would be turmeric. And earlier in the week I talked about taking high-dose turmeric, say capsules, as an anti-inflammatory if someone has inflammation in the body. And we've had some great results with that.
Turmeric, which has strong anti-inflammatory qualities, can considerably lessen gout-related inflammation. High dosages of up to 6,000 milligrams per day are safe to use, and the dosage can be lowered when the discomfort goes away. Turmeric may be made much more potent by mixing it with cayenne pepper, which makes it a great natural treatment for gout. Another natural treatment that Barbara O'Neill suggests is lemongrass tea. Because of this tea's significant alkalizing properties, the body's pH levels are balanced and the uric acid that causes gout is decreased. 3 or 4 glasses of hot lemongrass tea a day will help reduce inflammation and pain associated with gout and help control symptoms. These herbal medicines are a great complement to any gout management regimen because they not only reduce symptoms but also improve general health and well-being. Secret 2. Incorporate hydrotherapy for inflammation relief. Barbara O'Neill suggests hydrotherapy as an additional potent natural therapy for gout. During a gout flare-up, this therapy alternates between hot and cold baths to relieve pain and inflammation. 3 minutes of hot water are followed by 30 seconds of ice-cold water, and this sequence is repeated 3 times.
Now, to speed up the process, I did hot and colds. So this is a hydrotherapy, and tomorrow night Vanessa is going to give you a hydrotherapy demo, so you'll be exploring this more tomorrow night. What I did was I did the hot for 3 minutes, and she will be explaining in more detail why this works, and I did cold for 30 seconds. And I did this 3 times, so that's only, what, 10 minutes? Doesn't take long. And it brings a lot of relief because it causes a massive amount of blood to come to the area, and that pushes the old blood out.
According to Barbara O'Neill, this treatment strengthens the body's inherent healing mechanisms, encourages the evacuation of pollutants, and increases blood circulation. Gout sufferers can notice a major improvement in joint function and general comfort by adding hydrotherapy to their regimen on a regular basis. With little adverse effects, this natural method provides a secure and efficient substitute for medicine, enabling people to control their illness. Secret 3. Apply castor oil for joint relief when applied overnight to painful joints. Castor oil can significantly soothe and reduce inflammation, providing much-needed relief for gout sufferers. Castor oil, derived from the seeds of the Ricinus communis plant, has been used for centuries due to its medicinal properties. It contains ricinoleic acid, a potent anti-inflammatory agent that penetrates deep into the skin and tissues, reducing swelling and easing pain.
Now, castor oil penetrates deeper than any other oil, and wherever castor oil penetrates, it breaks up lumps, bumps, congestion, adhesion. It will break up a bone spur. If the bone spur has been there 3 years, it may take 3 months to break it up.
To use castor oil for gout relief, Barbara O'Neill recommends creating a castor oil compress. This involves soaking a piece of clean cloth in castor oil and placing it over the affected joint. Cover the cloth with plastic wrap to prevent leakage and secure it with a bandage. For added warmth and to enhance the oil's absorption, a heating pad or hot water bottle can be placed over the compress. Leaving the compress on overnight allows the castor oil to work continuously, deeply penetrating the skin and tissues. This extended application can help break down uric acid crystals that cause gout pain and inflammation, providing significant relief by morning. Additionally, the warmth from the compress helps increase blood circulation to the affected area, promoting healing and reducing stiffness. Secret 4. Adjust your diet. Gout management is heavily reliant on nutrition, and Barbara O'Neill stresses the significance of modifying one's diet to lower inflammation and uric acid levels. Gout flare-ups can be less frequent and the body's pH levels can be balanced with a diet rich in foods that generate an alkaline environment. A diet rich in fruits, nuts, seeds, and whole grains, together with dark green leafy vegetables, should be the cornerstone of a gout-friendly diet. Purine-rich meals can raise blood levels of uric acid, so Barbara O'Neill suggests cutting back on or avoiding them. These foods include some shellfish, beef, particularly organ meats like liver, and vegetables high in purines like asparagus and mushrooms. Gout attacks can also be avoided by abstaining from alcohol, especially beer, and beverages sweetened with fructose. Including alkalizing beverages in the diet has additional advantages. A balanced diet combined with regular exercise can help individuals achieve and maintain a healthy weight, reducing the burden on their joints and minimizing the risk of gout flare-ups. Secret 5. Stay hydrated. Maintaining proper hydration is essential for gout management because dehydration can aggravate symptoms and lead to flare-ups.
We're alkalizing the area. We're aiming to get more blood into the area to bring more healing. To ensure that the blood has enough water, it's important to drink adequate water. So water, 8+ glasses a day. If you're used to 3 glasses of water a day, start drinking 4, then start drinking 5, and then start drinking 6. A lot of people, especially elderly people, don't want to drink water because they don't want to have an accident or they don't want to have to rush to the bathroom and maybe not make it. So there is a way to drink water that will certainly lessen that, and that is little by little by little. Don't drink a whole glass at once. Drink 1/3 of a glass at a time, or 1/4 of a glass at a time, or a half a glass. Do an experiment one day and have a mouthful of water every 5 minutes and just see how much water you consume in a day just by doing it little by little by little by little. So the water is important to drink, and the water is also important out, and that's your hydrotherapy. Also, people may find that they can do this hot and cold in the shower, especially if you have a shower head that you can move. If it's the hip, you can do hot, cold, you can move it around like that.